So to continue on this series, we're on to our next topic, which is one that I truly want to hear more about. I'm so excited to have real medical experts talk about the problems and disparities, again, the gaps in the medical system.
Yeah.
I know when we were exploring the topic of this year's theme for Black History Month, health and wellness meant the stories behind segregated hospitals and things that we're facing,
Yeah.
but also Black women with fibroids and the infant mortality rate, like
Yeah.
women not getting the care that is equal to women who are not of color,
Yeah.
right?
Yeah.
And
you
no, go
know,
ahead.
a lot of those disparity studies, I want to make sure we're really particular and the dialogue that we're bringing here. This goes back generations and generations and back when physicians used to test African Americans when they were slaves without anesthesia. So there was this ridiculous notion that we could tolerate more pain. And perhaps we could because we were feared for our life. Maybe we thought that if we don't scream out as you're cutting me open with a blade, we will stay alive another day on the plantation or within the city. And a lot of times, as you talk about infant mortality, African American women are often given the epidural shot later in the stage simply because they feel we can handle more pain. I think that speaking up is prevalent. We have to speak up. You have to advocate for yourself. You have to research your physicians, right? But that also contributes to why a lot of African Americans are averse to seeking physician help because they haven't always lifted us up and acted in our best interest.
Right.
So speaking to people in the healthcare field about these things is really important because I do want people to understand there are folks who look like us. Out there gaining degrees, gaining knowledge, and researching and leading. I mean, look at COVID. Who helped with the vaccine? Right? There's a wealth of knowledge, and going to people who look like you oftentimes helps you in more ways. And not that you can't go to someone who doesn't, but having someone who understands why you might be afraid of the COVID vaccine, why you might be afraid of going to a hospital for childbirth. Those are so important to our community. And this conversation is one that really comes close to home.
I love it. And I'm seeing a huge trend in holistic health. I have a friend that opened a facility where there's a doula and there's like hormone therapy. So I love it, sort of that Uber story, right? Turning it upside down, having a hybrid look at how we can really provide the right care to the right people the right way.
Yes.
So I'm excited about that. I know
Me
you're
too.
going to have that conversation with one of our doctors, and I can't wait to hear more. And thank you for sharing your experience with us through this series.
Absolutely. Today, I'm here with Dr. Kimiko Williams, and we're going to talk about health and wellness and what does that look like for us as African Americans during this time. Thank you for joining us, Dr. Williams. It's so great to have you. Yeah. So I'd love to start out by learning a little bit about your history and why you're so passionate about being so effective in our community and all the research and the time commitment that you've put into our community. How did that start for you? What does that journey look like?
So, for those that don't know, I'm a physical therapist and I have been for 13, almost 14 years. And initially, so I've always been an athlete and I've always liked sports medicine. When I was in college, my grandfather had a stroke. And so I was introduced to the world of therapy. I don't think if I was able to be exposed to that, I would not have had a clue as to the different worlds of physical therapy, occupational therapy, speech therapy. And then so from there, that kind of set the path for me to determine how I could help people and what avenue to take.
Well, you're in the trenches every day, right? You're out there. You're a true American hero right now, especially in the climate that we're in. I'd love to know what you're seeing in our community. What are you seeing affect us from the healthcare field? And what are some things that you feel we could do to combat some of the challenges that we're facing, especially right now during a pandemic?
Well, for people of color or African Americans, there's definitely disparities, and especially in healthcare. And so the one thing that I've been seeing more so is just a lot of people bringing awareness to different things. I don't think we don't highlight enough. I think that there are people of color in healthcare, in positions. And since this whole pandemic, and I hate to bring everything back to COVID, but I'm starting to see more of people that look like me speak out and give information to educate, to put a face to a disease or a diagnosis, to put a face to education for those that are afraid or there's some mistrust as to what that looks like and what that means. So I think for me, being in healthcare every day from the beginning of COVID and having to be stuck at home and having to develop ways to still treat and still get information out to patients, we started doing telehealth and video chats and different things like that. So that's been totally different. We've never experienced that in healthcare before. And you're starting to see a wave of more and more of that. Like recently, I had a doctor's appointment myself, and it was canceled due to COVID and lack of staffing. And so the exam was performed via telehealth. And so I had been doing this for the last 2 years with my patients, but it was finally, for me, I was on the other end of that and I know how that felt. And so I think just letting people know that, they still have a voice, you can still communicate with your physicians or your healthcare providers, and you can still get the treatment and the care that you need. It just doesn't look the way it used to 2 years ago.
No, that's excellent advice. I think you may have noticed, especially since you're in the field day to day, a number of articles and an uptick in issues involving African Americans and the healthcare system, especially when it comes to African American women and their pain tolerance and childbirth and different things around that nature. It's obvious that every system is flawed. I won't say just our healthcare system is flawed, but every system has its unique idiosyncrasies that have to be ironed out. What are some things that we can do as African Americans to help initiate the change and to help speak up so that we develop more advocates to help us in our journey of wellness?
Well, I think going back to what I said earlier, I think it's important, even for like me, to try to mentor and to educate and talk to kids, adults, people that just are unaware of what you do. So I think, we have to do our due diligence in our profession, because I can't speak on someone else's profession, but I can definitely speak on mine. And so for me, it's the small things. It's when it's Breast Cancer Awareness Month. It's, giving out little pamphlets that educate people on what that looks like. And if you detect something, on the next steps to getting the help or the treatment that you need. Or even as far as me being in the school system and sometimes just doing like career day and different things like that. Plenty of people don't even know what physical therapy is. Sometimes they just assume that it's massage, and it's not, it's not. And so just educating people and letting them know like what you do, and me having a face of a person of color saying there are Black physical therapists. There's actually quite a lot of us here in the DFW area. So just things like that, I think it's important for us to just own that, to bring awareness to our profession and how we can help our community.
Yeah, I love that you mentioned mentorship, right? I think that is a huge area that could gain from improvement, an area in our community that we could shine a light on, building a gap, bridging the gap and building a bridge to connect others. What are some areas or some ways that you feel are great to approach someone for mentorship, especially in the healthcare realm?
Well, now that we're in the era of COVID, everything is kind of on hold for a lot of different things. But I think if whatever you do socially, I think you can use it as an outlet, right? So for me, I attend one community in Plano, and so they have a medical ministry. And so they have different professionals, different healthcare professionals that have different fronts and different ways that they can contribute to the team. And so just bringing awareness, for instance, in that setting. So I think just allowing yourself to take the setting that you're in as an opportunity to educate and to help someone goes it goes really far, and you don't realize it. I could be in a grocery store, and if I see someone that's ambulating, or in my professional terminology, gait training, and they're walking inappropriately or not holding an assistive device correctly, it doesn't do them any good or myself to just ignore it or walk by it. So I try to bring attention to things like that when I can. And just speaking to kids, I feel like, because a lot of kids, especially kids that look like us, they're unaware of the enormous possibilities that are out there. They don't know that, there is a plethora of different professions. And so sometimes I think society just puts us in a box where it's sports and different things like that, but there's so much more. And so when I see a nurse or a doctor or anesthesiologist or an x-ray tech or anybody, you know, it's our place to just say, hey, you know, this is what we bring to the profession. This is how we can help our community. And any opportunity you have to shed light on what you're doing, it's informative and it's helpful education.
No, that's great advice. This goes back to what we said, and we continue to say, you can't be what you can't see. And it's imperative for us to move forward as a culture to make sure we extend our expertise out to the younger generation. Another issue that is really close to my heart and something that I feel can never be spoken about enough is self-care, right? How do you as a healthcare professional try to make sure your patients understand the necessity of self-care and its healing qualities, and make sure that we as a culture begin to own it and embrace it and factor it into our everyday life?
Healthcare is huge. I mean, I can't say that, burnout is a real thing, whether you're in healthcare or any other profession, right? You get tired and you're not good for yourself or anybody else if you don't take care of your body, take care of yourself. And to be honest, we get so comfortable in the routine of the day to day. And so for me, honestly, with COVID, I hate to keep going back to that. It really forced me to sit down and start being a little bit more intentional about my mental health and just taking care of myself. And so whether that was me carving out time to pray, whether that's carving out time for me to work out, whether there was carving out time for me to just be still and sit outside and have a cup of coffee. I think that those things are important. Unfortunately, in our community, I think sometimes people use things like anxiety, depression, and different things like that as a negative thing. And I tell people all the time, mental health is an illness. It's a disease. It's no different than cancer, hypertension, or diabetes. So it's very imperative, very important that we pay attention to how we're feeling. It's very important that we take time for ourselves. And it's okay to say no to things. I feel like a lot of times we think we have to be busy, and that's not true. And I'm learning that as I get older, that it's okay to not have anything to do. And I think it's just very important that we start paying attention to our bodies, because our body tells us, right? It tells us our feet start to hurt if we're up on them too long, our back starts to hurt if we lift the wrong way. So the same thing with our mental health. When you start to feel foggy, tired, fatigued, and just not yourself, it's probably your body telling you need to take a step back.
Oh, I love that. Let's normalize saying I'm not okay, right?
Yeah.
Yeah. How
Absolutely.
tough is that, especially as in a role like yourself, a doctorate in physical therapy, someone who's out there leading research teams, who's board certified. There's a lot of weight, right, that comes with that, even for the normal person. But as a woman of color, the expectations of always showing up and the self-inflicted pain and pressure of showing up with excellence, right? How do you personally unplug? Is it that coffee? Is that coffee on your porch? Is it taking a walk? What are you doing for yourself?
It absolutely is. I've never appreciated sitting outside on a porch and having a cup of coffee so much more now in my late 30s than I did. Like in my 20s, I didn't even think twice, but now it's like, I am going to savor this. I'm not going to answer my phone. I'm going to truly unplug, not look on social media. I'm just going to spend some time with just my own thoughts. And I think people have to learn to be okay with that, like not the busyness of everything else and all the chaos. And I think it's difficult, of course, if you have a family and kids and things like that, but it's still important that you carve out that time for yourself. You absolutely have to.
Absolutely. I'm with you. I'm on the trend of unplugging and stepping back. Now, I know that there are a lot of new trends happening in the medical field, right? Especially right now, I think this pandemic is breeding innovation. What are some things you're seeing out there that we should be on the lookout for, things that will improve our quality of life, or things that we should just be aware of as a culture as a whole?
Well, some things that I've seen that are positive, and there's some things that I've seen that are negative. For instance, like we do grocery pickup, and this isn't to knock anyone that does it or doesn't do it. At first, I didn't find it very helpful. I thought it would make me lazy, right? And so with the pandemic, with the fear of going in the stores and different things like that, I was like, let me try that. And it cuts out time and different things like that. So I think I'm starting to see more of like a convenience for things. Like you don't use cash for anything anymore. Everything is Apple Pay or some sort of transaction that allows you to be fingerless, personless. Like everything is just we're going from like people interaction. And that's one thing I've missed with the pandemic, because we're starting to do a lot more of, like I said, video chats, telephone exams and different things like that. You don't get the people interaction. So that's the one thing that I feel like is negative or downside to some of this. But it's also a plus because, it decreases the risk of transmission of disease and germs and things like that. And it's convenient. It cuts down the time for sure for me as a clinician for documentation and things like that, but also for my patients. So I just feel like we're starting to see more of like the world is just operating in an intricate way that things are set up to be convenient for everyone. And before it was only for a select few, but I feel like the average person gets the convenience of, telework or VVC or grocery pickup now. Before that was like an elite thing, and that's no longer the case.
Yeah, I have to agree with you. The pandemic rebranded the QC code or QR code, right? It definitely helped us reach into the gig economy and really realize where we could delegate and how we could spend more time. I too embraced the grocery pickup so that I could spend more time with my daughter. Having that extra 30 minutes is relevant, it's impactful. And I think you are speaking some true knowledge here. Dr. Williams, I think I could talk to you all day. I love your energy. I love what you're doing. And I want you to keep shining and keep raising the bar out there as you're leading your research and guiding folks and helping them get back in tip-top condition. Thank you so much for joining us today.
Thank you for having me.